И начинаем, да?
Не слышно.
Student, good morning. Topic of our lectures today it's bone fracture. It's continue. Our commonly term is traumatism. Today we talk about the bone fracture. As you know, from the experience of ordinary life, we know that a fracture is a break or the crack in the bone. Fracture occurs when force exerted against the bone is stronger than the bone can structurally withstand. In these pictures, you can see this case. At the first pictures, you can see the following from the height. Next pictures, you can see the fracture when the patient has the rotated body with the Halloween. And next pictures, you can see this case when the patient has a diving and trauma for the bottom of the river. And next pictures, you can see this car incidents when the cars have the high speed. Its case have the stronger impact, then the bone can structurally withstand. Next slide. A cause of the bone fractures. Cause of the bone fractures can include traumatic incidents such as sporting injuries, vehicle incidents and falls, conditions such as osteoporosis and some types of cancer that cause bone to fracture more easily, meaning even minor trauma and falls can become serious. Student, mechanical trauma, it's one type of the trauma of the bone fractures. There is other type of bone fractures. The most common sites from bone fractures are the wrist, ankle and hip. But now we talk about the structure of the bone. Let's remember the structure. In this slide you can see the part of the bone. Initially the bone has integrity and continuity, and normal bone have the proximal epiphysis. Proximal epiphysis consists of spongy bone in here, article cartilage, epiphyseal line. Epiphyseal line, it's plate, growth plate, and next part of the bone is diaphysis. Diaphysis consists of compact bone, and outside compact bone covers the periosteum. Periosteum here, and inside this compact bone have the cavity. Cavity inside covers the endosteum, and cavity bone cavity have the medullary cavity and yellow marrow in here. It's a normal structure of the bone, and if your patient has the break, violation of integrity of the bone. It's signs of bone fracture. Commonly, a bone fracture is a medical condition in which there is damage in continuity of the bone, continuity of integrity. A bone fracture may be the result of height force impact, of stress. Two types of bone fracture, all minimal trauma injuries, as a result of certain medical conditions that weaken the bones, such as osteoporosis, bone cancer, or osteogenesis imperfecta, where the fracture is then properly termed pathological fractures. In this, we can see all type of fracture divided to two groups, two types: mechanical bone fractures, traumatic bone fractures, and pathological fractures. Patients have the pathological fractures when have the weakening of the bones, and this condition we talk, and I repeat: osteoporosis, bone cancer, osteogenesis, imperfect osteogenesis, and other type. Next classification of bone fractures divided two groups, depending on the years old of patients. And this group may be the bone fracture burst trauma of the bone, and other fracture bone which getting after birth. And now we talk about the bone fracture in the children, newborns. In this slide, you can see a brain delivered trauma. When the newborns deliver from vaginal tract, child have the position. In normal position, when the child have the head first birth in preferred, and next second position is normal position when the pelvic first birth. But if your child have other position, for example, transverse position and diagonal position, it's abnormal position for the liver. And the results of abnormal position and complication for the liver. Complications from birth trauma can include damage to the head, spinal cord, soft tissue, and organs. Trauma to the head of the infant can manifest as caput succedaneum, skull fractures, extracranial and intracranial hemorrhage, and cranial nerve injuries. Caput succedaneum is seen as edema in the scalp due to squeezing of the vein from increased pressure while passing through the birth canal. Birth trauma uncommon in the Western world in relation to rate in the third world. In the West, injuries occurs in 1.1% of cesarean sections. Cesarean sections is the sections abdomen and uter for birth child. And births may to have some type of bone fractures. At the first place, clavicular fractures. This type of bone fractures is the most common. An infant with clavicular fractures will not want to move his arm. The infant will likely cry if left under the arm on the affected side, as it is very painful. A chest X-ray can be administered to see if the bone is broken. This is typically no treatment for this condition, as the baby will fully recover within a few weeks. To ease the pain, the patient will need to lift and child gently and may pin the sleeve on the impacted side of the body to hip closes to immobilize it. A hard lump may be felt where the bone is filling. Many times this is the only indication that the baby had a broken collarbrain. There is typical few complication later in life from an infant born with this type of the birth injuries. It's important to note that a baby reluctance to move an arm may also be caused by near the elbow, Erb's palsy, and broken humerus, or another birth trauma. In the slide, you can see this trauma, birth trauma of the bone, and clavicular fracture of clavicula. The women have the narrow hole of pelvic, and when the child was delivered, vaginal tract, maybe to fracture of the clavicula. It's most often bone fracture of the birth. Next trauma, next fracture, it's long bone fracture in new bones. A long bone fracture in new bones is rare. The upper arm bone, humerus, all upper leg bone, femoris, may become twisted and break during a difficult vaginal delivery. The obstetrician may notice all here, the bone snap during delivery. All the injuries could go undetected until the child shows signs of injuries. These injuries may be invalidable, or it can also be the result of a doctor's error during delivery. Loss of spontaneous arm of leg movement followed by swelling and pain on passive movement are usually indicator that a long bone fracture has occurred. An X-ray of the bone is conducted to determine if it is broken and to rule out septic arthritis, which can present similar lesions. Treatment for a long bone fracture in a newborn is typically placing the injurious limb in a sling or cast to keep the baby from moving its around too much. This type of bone injuries typically heals quickly, with a recovery in 2 to 4 weeks. Future complications in this case are minimal. Now let's show this slide. This slide you can see the long bone fractures and new bones. And in this slide you can see the immobilize this bone, keep from the movement this leg. Next burst trauma may be epiphyseal displacement. On rare occasion, an infant may suffer epiphyseal displacement. This occurs when the rounded end and long bone in the arm or leg at its joint with adjacent bones become displaced. This can be diagnosed based on swelling, popping noises, and pain when the bone is moved. The baby will not want to move the bone and will hold its limb by her side. This injury is not visible in X-ray at birth because the bone is not developed yet. A callus will appear 8 to 10 days after birth, which will appear on an X-ray. Treatment of these injuries involved immobilizing the bone for 8 to 10 days. And this slide you can see the epiphyseal plate, the structure, epiphyseal plate. We can see the articular cartilage, a spongy bone in here, and epiphyseal plate. And when the patient has the epiphyseal displacement, now on this slide, you can see X-ray of child X-ray, and in this X-ray you can see the epiphyseal in here, epiphyseal femur, and epiphyseal plate in here. In this side, child may to have the displacement. Student, now I show you the second X-ray. This second X-ray is adult patients, and if you compare this X-ray, compare with this X-ray, you can see the adult patient have not epiphyseal plate of X-ray. Have not epiphyseal plate of X-ray. In this child X-ray, and you can see epiphyseal plate in here. And this slide you can see this femoral epiphysis, slipid capital femoral epiphysis in here. This is epiphyseal displacement during the delivery, birth. during the deliverables. It's epiphyseal displacement. It's the most important type of bone fracture child during the delivery. The first it's clavicular trauma. The second is long bone trauma fracture, and next trauma is epiphyseal displacement. Is more important. Other fracture bone which getting after birth, and as I told, this bone fracture divided to two groups: traumatic fractures, and pathological fractures bone. Pathological fractures. What is it, pathological fractures? These fractures also called insufficiency fracture. Pathological fracture is the bone fracture caused by disease that led to weakness of the bone structure. This process is most commonly due to osteoporosis. For example, adult osteoporosis, older patient is very often have the osteoporosis. Older patient which have older than the 60 years, 65 years. More this patient have the osteoporosis, but may also be due to other pathological, such as cancer. If a patient has the cancer of the bone and metastasis inside the bone, this patient to have the insufficient fractures. And other condition is infection, such as osteomyelitis, and maybe inherited bone disorders, all the bone cysts. Only a small number of conditions are commonly responsible for pathological fractures, including osteoporosis, osteomalacia, Paget disease, osteitis, osteogenesis imperfect, benign bone tumor and cysts, and secondary malignant bone tumors and primary malignant bone tumors. Its condition led to pathological fractures. The most important signs of this fracture, of pathological fractures, caused by insufficiency trauma. Don't stronger, but insufficiency trauma. It's usually movement. In this case, in this slide, you can see the pathological fractures of the humor in the patient with the metastasis of renal cells carcinoma. And in this slide, you can see the X-ray of femur, and below you can see the compact bone, and in here where the caput of the femur, you can see this weakness of the bone, and maybe to usually movement led to break in this of the bone. It's pathological fractures. Next slide, you can see the femur bone, And to this patient have the osteomyelitis, and you can see the patient have the destruct of the bone, and side with weaken of the bone in here, weaken on the bone in here, and this patient too can have the pathological bone fractures. It's this osteomyelitis. Osteomyelitis is infected effect of the bone. This bacterial genesis and destruct of the structures this bone led to pathological fractures. In the slide you can see the treatment of pathological fractures with the metal plate, metal rod. In this you can see break of the bone in here, and this you can see the signs of the pathological fractures. In this you can see the methods of treatment in pathological fractures in here. Next slide, you can see the tibia and fibula, and this you can see two pathological fractures. Why? It's X-ray have the signs of osteoporosis of the bone, and in this place, this patient have the fractures, break of the tibia and break of the fibula. In here, it's pathological, and this you can see two fractures of the tibia fibula and signs of the osteomyelitis. Condition of osteomyelitis led to pathological fractures. Even the patient have the normal movement, don't stronger impact, and this pathological fractures in here. Next classification, student. Next classifications of bone fracture in this slide you can see the close bone fractures. What is it? Close bone fractures. Close bone fractures have not injuries of the skin, injuries of the derma, and this closed fractures. Now I show you next type of bone fracture. It's open bone fractures. And the slide you can see the break of the humor and damage of the skin. It's open bone fractures. Its complications, bone fractures, and its type of bone fractures need to surgical treatment. Why to know the classification of bone fractures? The bone classifications indicated to us what type of treatment we choose for treatment these patients. And Next classification is type of fractures line of the break. Line of the break. No, the first close and second open we talk about now. I repeat, the close fracture, bone fracture following not damage of the skin, and open bone fractures followed damage of the skin. Close bone fractures on complications bone fractures, open its complications bone fractures. Next line of the break may be transverse line. It's beta bone fractures. Applique line. Next line, spiral bone fractures. The patient have spiral bone fractures when the patient's fixing the leg and other part of the body have the rotate, and very often this patient have the spiral line of the fractures. No, next line, communitate. When the patient has the break line with a lot fragment of the bone. It's very difficult bone fractures, and these bone fractures very often need to surgical treatment. Так, next line, intra-articular line is difficult bone fracture. If your patient have intra-articular line, this patient need to surgical treatment, and it's very difficult treatment, type of the treatment. Так, no, next type of the line, segmental line. Так, when the patient have segment, one fragment of the bone. Here, longitudinal line. Longitudinal when the break line compare with the axis of the bone. Compression bone fractures. No, very often it's vertebra compression bone fractures when the fragment of the bone press to each other. The compression. Green stick line. It's incomplete bone fractures when this line have the start of the line and have not the end of this line. Green stick. It's a better type of bone fractures, and it's bone fractures need to conservative treatment. No, very often for cast, embolized for cast. Так, next type is displaced bone fracture and non-displaced. Non-displaced is better. If your patient has a non-displaced, it's don't difficult treatment this patient. If patient have displaced, it's more difficult type of bone fractures, and this fragment of the bone need to connect. Need to connect this fragment with each other. Maybe it's handly reposition, maybe surgical reposition, but this patient need to reposition and connect this fragment. Now in this slide you can see this type which I talk about, this transverse line, longitudinal line, linear, oblique, non-displaced, oblique displaced, spiral line, green stick, and comminuted, which this bone has a fragment, a lot fragment. Close. This form of considered easier than open. This is due to the fact that damage to only bone tissue in characteristics for such as fractures, and the skin ligament muscles remain intact. Open bone fractures. Such a fractures is accompanied by damage not only to the bone, but also to violation of integrity of the soft tissue that communicate with the external environment. Complete and incomplete bone fractures. In this X-ray, you can see this complete and incomplete. In the first X-ray slide, you can see the complete bone fractures, and this second X-ray, can you see the incomplete bone fractures, but it's interarticular bone fractures. This line have the start in this and have not end of this line. It's incomplete. A green stick. It's a subperiosteum bone fractures. Green stick. In the slide, you can see the X-ray of the child. No child about the 4, maybe 6 years ago, or maybe 4 or 6 years child. In this type of the bone fractures, it's green stick in here, green stick in here, green stick in here. It's non-displacement bone fractures, and this bone fracture need only immobilized. No, about the 3-4 weeks. Child has quickly healing of the bone. If your child have no displacement of the bone fragment, it's immobilized, applied to 3-4 weeks and enough. Longitudinal bone fractures. In the slide, you can see this line of the break in here. It's ulnar bone. It's radial bone. Ulnar bone. In ulnar bone, inside the ulnar bone, you can see this line of the break, longitudinal line. And in this case, and if you compare in this slide, in this you can see the child bone Y. In the slide you can see the epiphysis and epiphyseal plate in here. In this you can see the epiphysis and epiphyseal plate in here. But in this X-ray you cannot see alone epiphysis
and epiphyseal plate. It's adult patients. It's adult patient, and its adult patient have the longitudinal bone fractures, ulnar bone. But this longitudinal bone fractures non-displacement, and to its patient need to mobilized by plaster casts. And about the 4, maybe 5 weeks will have the recover these bone fractures. Next bone fractures is we have the obliqua bone fractures in here. And this patient and we can see little displacement, fragment of the bone, little displacement. This bone fractures need to reposition connected this fragment. If you have this reposition handily, it's right. It's don't reposition this handily. This patient need to surgical reposition, full surgery. And at the first, we can make a reposition this fragment, and after that, we immobilized this bone. Так. In this slide, you can see the very difficult bone fractures. And at the first day of bone fractures, why? We can see the splint. Its patient right arrival on the hospital, and you can see the splint for immobilization. This. And we can see the fragment, a lot fragment of the bone fractures in here, and this bone fracture need to surgical type of the treatment in here. Okay, student. Now we talk about the repair of the fractures. Repair of the fractures have the 4 steps. The first steps, hematoma formation. And this slide you can see these steps. Hematoma formation. It's the first day. The first day after the bone fracture, after the break. Hematoma formation. Hematoma formation, mass of clot blood in here. Mass of clot blood. This mass of clot blood led to a development of second stage. Second stage is callus formation, soft callus, cartilaginous callus, and it's soft callus in here. Development soft callus in here. External callus and internal callus in here. And you can see the development of new blood vessels in here, in soft callus. Next, third step, it's bone callus formation. At the first formation, the soft callus in here, cartilage callus. And from the next week, development of bone callus. Bone callus is hard callus in here. And fourth step of repair is bone remodeling. Remove spongy bone of hard callus replaced with compact bone. And 4 steps of remodeling at the end of repair bone fractures. Now we talk about the complications of bone fractures. All type of complication divided to systemic complications of bone fractures and local complications. No systemic complication when we have the responsible whole body on this trauma. Systemic. Its systemic hypovolemic shock. Hypovolemic shock. If your patient has open and maybe close bone fractures and damage of the vessels, this patient has bleeding. No, for example, it's very often the bone fracture of the pelvic bone, and bone fractures of the femur, of the led to mass bleeding. Maybe student. Bone fracture of the pelvic bone led to massive bleeding and maximal last blood maybe about the 3 liters of lost blood. If your patient have the bone fractures of the femur and damage of the femur artery, it's led to bleeding and blood lost about the 1.5 liters. And this bleeding led to systemic hypovolume shock. It's systemic complications. Early complications, and late complications. Local complications, local injuries to major vessels, injuries to muscular muscles and tendons, injuries to the joint, and injury to viscera. Its injuries led to local infection and development of osteomyelitis, post-traumatic of osteomyelitis, and compartment syndromes. It's early complication, and late complications, local injuries. It's short tanning of the leg, joint stiffness, sciatic dystrophy, osteomyelitis is infection complications when the local damage and bacterial enter to inside the soft tissue and the bone tissue, and development of osteomyelitis, and ischemic contractura, myositis, and other local complications. Treatment of the bone fractures have the two-step. Treatment includes immobilizing the bone with a plaster cast on surgical, inserting metal rods all plate to hold the bone pieces together. The first type of treatment bone fracture is the conservative methods. If your patient have bone fractures with displacement, at the first we can reposition the fragment of the bone. Reposition very often we can make this reposition handling, reposition and immobilizing, and 80% of all bone fractures need to this conservative method and immobilizing the plaster casts. Like this pictures in here, plaster casts in here, and this plaster cuts immobilizing. But other different bone need to different period for immobilizing. No, about from 4 weeks to 6 to 8 weeks, and maybe in some case maybe it's longer. It's a conservative methods. Reposition and apply to plaster casts. Next method at skeletal traction. No, very often this method can use with the bone of the femur and bone fractures of the tibia. What is it? Skeletal traction. On this slide you can see if your patient have the bone fractures of femur, we can insert a needle and connect it with metal plate. If your patient have the bone fractures of tibia, we can insert a needle in here and fixing of the construction in here. And next, this patient lay down of this special bed for skeletal traction, and we can tendons in here with helping weight mass. If your patient have bone fractures of the femur, the mass of this weight, about the 10% of weight body of this patient, 10% of weight body. If your patient have the bone fractures of the tibia, the weight of this mass about the 6-7% of the body weight of these patients. And skeletal traction led to connected fragment of the fracture bone, and recover this. But is last time we can use this very rare. Why? Now we have the modern better methods of treatment, and now I show you next type of the treatment. In this photo you can see these methods of skeletal traction. This patient have bone fractures of the femur, and in this through the tibia insert the needle connected with this metal plate, and tend with the weight. This weight mass 10% for 10% from the weight of all body these patients. In this next type of treatment, external type of surgical treatment, when it's compression method of treatment, bone fractures. Why it's external? We can insert needle inside the bone, but as a construction for compression and maybe this traction, compression and traction in here is external from the body. Hello. And next type of the body is a surgical type of the treatment. In this X-ray research, you can see the bone fractures of femur, middle of the femur in here, bone fracture, and this surgical type of treatment. When we can use a metal plate for fixing the fragment of this bone, and this metal plate fixing with help the screw. In the slide you can see that screw in here. This fixing in plate. And when we can fixing fragment of the bone in here to about some weeks, we have at the first we have the cartilage, callus, but about the 1-2 weeks bone callus in here, and remodeling this bone. After the 4-6 weeks, this recover the bone fracture, and maybe about the 2-3 months, we can remove this metal plate. Next type of treatment is in this slide you can see the fracture nick of the humor, nick of the femur, and fixing with screw through the nick of the femur. Student, it's different type of the treatment. External methods, external osteosynthesis, and this you can see internal osteosynthesis. Why? This screw insert through the inside of the bone, and this you can see the bone fractures of the tibia and fibula, and you can see two different methods of the fixing bone fragment. Tibia, it's fixing for the screw, and fibula fixing with helping the plate. metal plate in here. But we can use the screw, a little screw in here. But you can use the plate, metal plate in here. And in this, you can see the needle insert inside the bone, inside the fibula. And fixing in here tibia, fixing in screw. And this, you can see two metal plate, fixing for the little screw in here, and this tibia fixing for the screw and this needle тоже. Okay, in this slide you can see next apparatus. This prior to 1981, the Elizarov apparatus was used exclusive in the Soviet Union. What is this apparatus? Apparatus for external osteosynthesis. External osteosynthesis, where the fixing bone with helping the needle. In the slide you can see this fixing bone with helping the needle in here, and external part of this apparatus we use for the compression of this destruction, in here. Now, for this slide, you can see this methods. This patient have the bone fractures of the tibia. And this Elizarov apparatus is the type of external fixation used in orthopedic surgery to lentil the reshape limb bones as a limb sparing technique to treat complex and all open bone fractures, and in case of infected non-unions of the bone that are not amenable with other technique. It's the name after the orthopedic surgeon Gavril Abramovich Elizarov from the Soviet Union, who pioneered this technique. In this slide you can see the needle which insert for the bone, and external round in here connected with each other for immobilization this bone, fragment bone. We also said this construction, it's modification of Elizarov apparatus in here, and in the slide you can see fixation the bone with the needle, maybe all screw, and this screw and needle insert through the bone, and external part of fixing this needle, this screw, external part of outside. In this you can see this apparatus. Primary bone healing when occur like when you are using a compression plate. The surgical treatment. In the slide you can see this surgical treatment. It's tibia and fibula in here, and you can see you can see this insert the fixing needle in here, and fixing needle connect with this external part of this apparatus, external part, and fixing and maybe rotate and fixing this bone. It's surgical method of treatment. Student, next slide. You can see the methods of diagnostic bone fractures, and main methods of diagnostic it's X-ray research. It's older time. We can use these methods in traumatological, and these methods give us this a very better imaging for this pathology. No, in this slide you can see the fracture of the clavicula. And in this slide, to these patients with bone fractures of the clavicle in here, and external we can see in this imaging of bone fractures. You can see the deformation. When we palpation here, we define this the hair in here, and this treatment type of the treatment, this bone fracture clavicula. In this case, surgery choice applied to metal plate, which fixates the screw in here. And how you can see, it's fragment of the clavicula connect each other, and in this case, recovery is better. Next method. You can see in this arm, you can see is fracture of the ulnar and radial bone, and you can see its child. Why? In this X-ray, you can see the epiphysis and epiphyseal plate in here. In the sign, you can see only the child X-ray. If you're adult patient, we cannot alone epiphysis and epiphyseal plate. This is child. Well, maybe 6-8 years. And this patient has a bone fracture of the ulnar bone, radial bone, and methods which choose the doctors for the repair this bone fracture. Insert the needle inside the bone, inside the radial bone, inside the ulnar bone. At the first day after surgery, and this after the some days after the surgery. And in the slide you can see the development of callus in here. No, in this case cartilage callus. When the patient has the bone callus, it's don't soft, it's hard, compact bone in here, and it's hard callus. Next, bone fractures. It's fractures to its child. It's very usual bone fractures when the child fallen on the floor, and break in here, break radial and break ulnar bone in this site. This child have a little displacement bone fragment, and these methods of the treatment in conservative method, it's the first make the reposition and connected fragments, handle reposition connected fragments of the bone in here, and immobilized with helping the plaster casts. In this X-ray you can see this plaster casts. And this method is it's right. Why? This fragment connected each other is very right. And after 4 weeks, it's healing these bone fractures and non complications. This patient have no complications after this treatment. Okay, it's a spiral bone fractures. You can see this spiral line in here, It's very difficult bone fractures, and its bone fractures need to surgical methods of the treatment. It's femur, it's spiral line of the bone fractures. What and it's same bone fractures. But it's other man. What in this slide you can see line of bone fractures, and methods on bone fractures. It's intraosteum osteosynthesis. You can see intraosteum insert the rod set in intraosteum and fixing the screw in here. It's right embolization. Why? Fragment of the femur. Fragment of the femur is connected. It's right in here, and after 4-6 weeks, this recover bone fractures, development of callus at the first soft callus, next the bone callus, and remodeling this bone, and after 2-3 months you can remove these rods inside the bones. Okay, it's two bone fracture of the femur, humor, and this doctors choose these methods with helping the metal plate in here for fixing fragment, and fixing with helping the screw in here. Surgical method. Так. No, it's X-ray for bone fracture or clavicular. We can see the same bone fractures. Okay, it's femur. It's fracture of neck of the femur. It's very difficult bone fracture. Why? Very often this bone fracture have the older patient, adult patients, more than 60 and 65 years, and this patient have the osteoporosis of the bone. Osteoporosis of the bone don't let to quickly repair this bone fractures, and this patient in modern time, this patient need to surgery for surgery with helping the implant of the article joint. There are methods of connected in here. I can see, but it's modern methods. It's remove this joint and implant of the article joint in here. It's better method. In this slide you can see the bone of femurs in here. Okay, today it's enough, and we at the end our lectures, and after the 2 weeks we have next lectures. Okay, goodbye.